Hello everyone, welcome to session on pharmacokinetics and pharmacodynamics, 50 multiple choice questions. Question number 1, what is a pharmacodynamics primarily concerned with? You guys can pause the video and come up with the correct answer, then we can discuss the correct and incorrect options. The correct answer is the effect of drugs on the body. So when you see the pharmacon means the medication or drug, dynamics means the force or action of the drug. Whereas distribution, absorption, excretion, metabolism is pharmacokinetics. Pharmaco means medication. Kinetics means movement of medication, where it moves in the body, like absorption, distribution, metabolism, excretion. That is the kinetics. So dynamics means the mechanism of action, receptors, targets, adverse effects, therapeutic index. That is the action of the drug, pharmacodynamics. Question number 2. The ligand or medication binds to the receptor and elicits a response. Which of the following? The correct answer is agonist. Agonist binds to receptor and produce a response. That is agonist. Whereas antagonist binds to receptor, no response. Question number 3. A drug binds to receptor and produces less than 100% response. Which of the following is a drug X? The correct answer is partial agonist. Partial agonist, the response is less than 100%. So when you see the dose response curve, so you have a full agonist, 100% response. So whereas a partial agonist, less than 100%. Antagonist binds to receptor, no response. Inverse agonist, it's like this. Question number 4. 3 investigational drugs A and B and C to treat hypotension have undergone phase 1 clinical trials. A graph of the biological effect is shown here. So which of the following statements is true? The correct answer is the drug C shows lower potency than drug A and B. So when you see the drug C here, the EC50 is higher compared to drug A and drug B. What is EC50? The EC50 effective concentration or effective dose is required to produce 50% of the response. Whereas a drug A EC50 is a less dose. You see, for example, this is a 0, this is a 5, this is a 10, or this is 15. So at 5 milligrams, it produces 50%. The drug B, 10 milligrams EC50. Drug C, 15 milligrams. So if the higher dose means lower the potency. Given a quantal dose response relationship, the dose response curves for the therapeutic effect EC50, the therapeutic effect, we call it as the ED50, effective dose, and toxic dose, that is a TD50, that is a death, or LD50. That means 50% of the tested population. So which of the following is calculated about this drug, these parameters? The correct answer is therapeutic index. So therapeutic index, you can remember TILE. Therapeutic T, I for index, therapeutic index, L for lethal dose, E for effective dose. So therapeutic index equals to LD50 over ED50. So usually if you have more therapeutic index value, so usually therapeutic index, there is no units. If you have more therapeutic index, the drug is more safer. If less therapeutic index, the drug is a narrow therapeutic index. Even the slight rise in the plasma concentration leads to serious drug adverse effects. Question number 6. A drug binds to the same receptor as an endogenous neurotransmitter. In the presence of a drug, the endogenous ligands, the Emax remains unchanged, but the dose response curve shifts to the right. What type of drug is this? The correct answer is this is a competitive antagonist. So that means in the dose response curves, so if you take this is the full agonist, drug A, then you have an antagonist with agonist. So this is A plus B. A is the agonist, B is the competitive antagonist. So that means it shifts the curve because you're increasing the agonistic concentration to remove this guy from the binding site. So competitive antagonist means both agonist and antagonist compete for the same binding site. That is a competition, right? So that's what your action is coming back. So that's what Emax remains same, where only potency is decrease. So that is a competitive antagonist. What is an agonist in pharmacodynamics? The correct answer is a substance that activates a receptor. Which of the following is an action of non-competitive antagonist? The correct answer is that decreases the maximum response to agonist. So non-competitive antagonist, for example, this is the full agonist, whereas in the presence of non-competitive, the dose response curve like this. The Emax is going to decrease. Which of the following best describes the drug mechanism? The correct answer is the interaction with the cellular receptors, that is pharmacodynamics, whereas the distribution, elimination, absorption, these are pharmacokinetics. Question number 10. A pharmacologist is evaluating a drug analog to find the most potent beta-2 receptor agonist. When analyzing the data, the biomarker that you should screen for is, the correct answer is EC50. The EC50 is a parameter we can use to analyze the potency of drugs. Identify the Cmax, the concentration, maximum concentration in the following plasma drug concentration curve. So x-axis is the time, y-axis is the plasma drug concentration. The concentration maximum, that is number 2, that is a maximum plasma concentration. Number 2, that is the Cmax. Identify the Tmax, that is the time required to achieve the maximum plasma concentration. So this is Cmax, so number 4 is the Tmax. Identify the onset of action in the following plasma drug concentration curve. So onset of action means the starting point where the patient get the therapeutic response. So when it achieves, that is when the plasma concentration reaches the minimum effective concentration. This point, that is the onset of action. So that means if the patient is taking acetaminophen paracetamol for the headache, after taking the medication, you won't get immediately, right? So when you take oral pill, it needs to disintegrate, dissolute, absorb into the circulation. That take 1 hour, right? So you can see the onset of action is 1 hour. Identify the minimum effective concentration. That means that is a starting point, it may get its response. So the correct answer is number 3, that is the minimum effective concentration. Above this level, so here the patient will get the therapeutic benefit. So this is the minimum effective concentration. So below this, you don't get any response. Above this, you get toxic effect. So please subscribe, so you can see the subscribe button, just one click, so that will encourage me to do more videos for my students to help to understand all these complex medical science topics in the easier way. Identify the duration of action of the following plasma drug concentration curve. The duration of action, this is number 4, that is the duration of action. That means from the onset of action, then the plasma concentration drops below the minimum effective concentration. Number 4 is the number 4 is the Tmax. Number 5 is the duration of action. Number 5 from this point to this point, that is the duration of action. Number 4 is the Tmax. So question number 16, which of the following routes of drug administration is most likely to have the highest first pass effect or metabolism? The correct answer is oral route, because oral route of administration or enteral route of administration, the drug needs to be absorbed into the portal circulation, then go to the liver, then go to the systemic circulation. While traveling all these, there is a lot of crossing, so the lot of drug is metabolized. So that's what highest pass metabolism, and the lowest drug is reaches the systemic circulation. So whereas the intramuscular, subcutaneous, sublingual, intravenous, the majority of drug enters systemic circulation, there is only bypassing the liver, less first pass effect compared to oral route. Question number 17. Similar dose of drug are given by mouth and intravenously. The blood is sampled at various times. The blood concentrations of the medication are measured and data are plotted attached below. The data will allow you to determine which of the following. So by looking this graph, so which pharmacokinetic or pharmacodynamic parameter you guys can identify, that is the bioavailability. So when you give the intravenous route, so you have 100% bioavailability, right, compared to other routes of drug administration. Question number 18. A 68-year-old man suffering from stroke started treatment with the alteplase, that is a fibrinolytic agent to break down the fibrin, and the drug has a high volume. The volume of distribution is 8 liters. Which of the following is most likely the main site of distribution of this prescribed drug? So that is a vascular compartment, because if the volume of distribution is less, means you can think of it is mostly vascular compartment, intravascular. Alteplase is a high molecular weight, and it won't cross the membrane easily. It restricts to the vascular compartment. So the drugs reaches the adipose tissue, extracellular fluids, cytoplasm, interstitial fluids. If they have more than 10 liters volume of distribution, then you think of all these other site of distribution. Question number 19 to 25, we are going to see what are the various equations. The volume of distribution is what is the equation? So volume of distribution equation is the dose over concentration. All right, so dose over concentration. The next equation you can think of the loading dose. Okay, so loading dose, just you rearrange this volume of distribution equation. So that means the dose, you can say that is the D, right? So loading dose. Then this is the volume of distribution times concentration. So concentration, target plasma concentration or steady state plasma concentration. Then we divided by bioavailability, FL. All right, whereas a half-life, that is usually 0.7 times VD over clearance, that is half-life. Whereas the maintenance dose always depends on the clearance, okay? And you need a target concentration or steady state concentration. And remember, maintenance time interval, T for time interval, okay? How often you have to give the maintenance dose over bioavailability, okay? So clearance, just you rearrange this equation, the half-life. So clearance equals, so so clearance equals 0.7 times VD over half-life, right? So then you can think of the infusion rate and other equations. The infusion rate is the K0. We don't use most commonly, but for the completion of the sake, so you can say the infusion rate equals the clearance, because clearance times CSS. Okay, so that is the infusion rate. Whereas a elimination constant is the clearance over volume of distribution. Okay, so most important equations: volume of distribution, half-life, loading dose. Loading dose easy to remember. Loading, D, volume of distribution, easy to understand. Maintenance dose and clearance. If you know these four equations, majority you can calculate. 1, 2, 3, and 4, and 5. 5 equations. Okay. Next one. Question number 26. A new drug that follows the first order kinetics was studied in a healthy volunteer. A 40 milligrams dose was given intravenously. The initial plasma concentration of the drug is 4 milligrams. Which of the following is the volume of distribution? Right. So just you can use the equation, volume of distribution equation. So how to calculate volume of distribution, right? So the correct answer is 10 liters, right? So volume of distribution equals dose over concentration. So what is the dose? So dose is a 40 milligrams over concentration is 4 milligrams per liter. So the milligrams goes away. So 4 times 10, so that is the 10 liters. So a new drug that is followed first order kinetics, and in the healthy volunteer, a 40 milligrams of dose was given in this patient. The initial plasma concentration of the drug is 4 milligrams. The volume of distribution 10 liters. Half-life is 7 hours. So what is the volume of which of the following is the volume of distribution? Okay, so in this equation we already gave the answer, right? So you don't need to we gave the volume of distribution, and okay, so I think this is we need to skip. We have some issue with this. I think we are not the volume of distribution we are asking here. So we are asking the clearance. So which of the following is the clearance? Right? So clearance, the correct answer is 1 liter. Right? So what is the equation? So half-life, you can use the half-life equation, 0.7 times Vd over clearance. So then clearance equals 0.7 times Vd over half-life. So that means 0.7 times Vd is 10 liters over, and half-life is 7 hours. So 10 times 0.7 is the 7 liters over 7 hours. So that is the 1 liter per hour. Okay, so this is not a volume of distribution, so you need to calculate clearance. Question number 28. The drug X activation leads to a receptor leads to upregulation and activation of G protein coupled receptor. This receptor is most likely to be found in which of the following locations? So G protein coupled receptors, those are the majority receptors of the drugs, right? So this is mainly present in the plasma membrane. So in this you can see this type of G protein coupled receptors, GPCR. Whereas cytosol and nucleus, these are intracellular receptors. You can think of steroids and thyroid hormones. When a particular ligand binds to its receptor, this binding induces cleavage of phosphatidyl inositol bisphosphate into inositol triphosphate IP3 and diacyl glycerol DAG. Which of the following would be an example of similar class of receptors? This is the GQ receptors. I have created a separate video on how to remember all these receptors. You guys can watch that video, how to remember G protein coupled receptors, their ligands and second messengers. A nice video, easy to remember. Okay. Which of the following is the most likely to occur when administered insulin binds to its receptor? So the correct answer is that is a tyrosine kinase. Four main processes of the pharmacokinetics for orally administered drug. So which of the following the first process occurs? The correct answer is absorption, right? So first is absorption, then distribution, then metabolism, then excretion. Question number 32 is 100 milligrams of dose of a drug is given orally, only 40 milligrams reaches the systemic circulation. Assuming no distribution and elimination, which of the following is responsible for its decreased levels of the drug in systemic circulation? So this is mainly because of first pass metabolism. When you give orally, so that needs to be, so this is the oral route of administration, right? So you have a liver. So when the drug is diluted, then absorbed into the liver through portal circulation, right? So it needs to be crosses several membranes and in the liver, then it goes to the heart, right? So during crossing, there is a lot of first pass. So that means the first crossing the membrane, the drug is metabolized. So that's what orally given medications, they have high first pass metabolism. The low amount of drug is reaches the systemic circulation. Question number 33. So here a 33-year-old man was admitted to the ER with an overdose of amphetamine. The plasma concentration of the drug at the time of admission is 20 milligrams per liter. The volume of distribution is 70 liters. Half-life is 60 minutes. What is the ingested dose? The correct answer is 1400 milligrams. So that means here you can see you need to calculate the dose, right? So volume of distribution equals dose over concentration. So dose equals volume of distribution times C. So what is the volume of distribution? Is a 70 liters and concentration is the 20 milligrams per liter. So liter goes away. That is a 1400 milligrams. Question number 34. A 34-year-old woman is brought to the ER. EKG shows ventricular tachycardia. Her body weight is 50 kgs. BMI is 24.5. And the physician initiates the treatment with intravenous dose of antiarrhythmic agent. Plasma concentration is 5 milligrams per liter. Volume of distribution 2 liters per kg. Which of the following is the most appropriate loading dose? Calculate the equation for loading dose. You guys can calculate loading dose equals volume of distribution times concentration. Because here intravenous, so that means bioavailability over 1, right? F equal to 1. So you can calculate, the correct answer is 500, right? So the VD is how much? So how to calculate VD? So VD equals, so per kg 2 liters per kg. What is the body weight? 50 kgs. So 2 liters for 50, that is 100 liters, correct? So 100 liters times concentration is the 5. So that is a 500 milligrams, correct? So that means the concentration 5 milligrams per liter goes away. So 500 milligrams is the loading dose. So the image attached shows the mechanisms by which the drugs crosses the membrane. So when you see the image, you have the sodium potassium pump using the ATP as a source of energy. The correct answer is active transport. Active transport uses energy and move across the concentration gradient. Whereas passive diffusion, facilitated diffusion, endocytosis, filtration don't use the energy as a source of movement, right? So passive means passively moves. Facilitation means there is some facilitator like transporter, but there is no ATP requirement. Endocytosis not requirement. Filtration simply moving through the pores. Here you have a drug X, the volume of distribution 500 liters, clearance is 240 liters per minute. The bioavailability 50%. Okay, so you can say 50% means off, right? So 1/2. Which are the following doses required to achieve the concentration is the 50 micrograms per liter. Okay, so we are asking what dose is required to achieve the. So you can use the equation maybe volume of distribution, you have steady state bioavailability. Again, we can use the loading dose equals Vd times steady state concentration over F. So Vd is how much? 500 ml. So 500 liters times concentration 50 micrograms, and 1/2 means that is times 2. So see what is your correct answer. That is 50 milligrams, right? So that means so which of the following is an example of cytochrome P450 enzyme inhibitor? So make sure you know the cytochrome P450 inhibitors and inducers. So the inhibitor is erythromycin, right? So macrolide antibiotics, clarithromycin, and cimetidine, omeprazole, all these are inhibitors, whereas rifampin, phenobarbital, phenytoin, and carbamazepine, these are cytochrome P450 inducers. So you should be careful while combining other drugs. There is a drug interactions. Question number 38. Which of the following routes of drug administration has the lowest plasma drug concentration? The correct answer is oral route because high first pass metabolism. Question number 39. Which of the following has the highest therapeutic index? The correct answer is penicillin. Whereas a warfarin, digoxin, lithium, narrow therapeutic index, even the slight rise in the plasma concentration, severe adverse reactions. If the drug is ionized state, the correct answer is that is a water soluble. If drug is unionized state, that is a water insoluble, lipid soluble, hydrophobic, lipophilic, that is non-ionized state. So lipophilic means lipid soluble, hydrophobic, lipid soluble, water insoluble, that is non-ionized state. So non-ionized state easily crosses the membrane. Which of the following cell organelles will have most of the cytochrome P450 enzymes? The correct answer is smooth endoplasmic reticulum. Phase 1 biotransformation reactions are, there are two phases, phase 1 and phase 2, right? So the correct answer is oxidation, reduction, hydrolysis phase 1, whereas phase 2 reactions, glucuronidation, acetylation, sulfation, methylation of biotransformation or metabolism reactions. Which of the following defines the rapid decrease in response to medications? That is tachyphylaxis. So tachyphylaxis means there is a rapidly develops the tolerance. So that is a tachyphylaxis. Anaphylaxis means this is a hypersensitive reaction. For example, patient is allergic to penicillin. So there is development of anaphylaxis. Idiosyncrasy means unpredictable adverse effects. Sometimes the medication causes severe adverse effects, unpredictable. Tolerance means over the period, after a couple of months, years, slowly develops the ineffectiveness to the drug. Example of tachyphylaxis, that is a rapid development of tolerance, is the nitrates, usually ibuprofen, losartan, hydrochlorothiazide, lisinopril, so it won't develop immediately tolerance. Question number 45. Drug A has a magnitude of effect of 2, drug B magnitude effect of 2. If the drug A and B combined, the magnitude is 4. This would example of which of the following? The correct answer is additive effect. So that means the 2 plus 2 is a 4, that is addition. So synergism potentiation means that 2, the synergism basically 2 plus 2 more than 4. Whereas potentiation means Here one drug is active, for example amoxicillin is active when you combine with the clavulanic acid is inactive medication. But if you combine these together, it potentiates, the clavulanic acid potentiates the action of amoxicillin. Neutralization, it's a kind of antagonistic effect. Okay, so additive effect is 2 plus 2 is a 4. That's additive. Botulinum toxin is a protein with a molecular weight of approximately 150,000 daltons. So which of the following transport mechanisms are responsible for crossing the membrane? It's a very large molecule. The correct answer is endocytosis. Okay, so if the molecule is very large, it has to go through the endocytosis. Which of the following is the most likely a consequence of activation of beta 1 adrenergic receptors? The correct answer is increases cyclic AMP, that is by activation of GS protein. I have a nice YouTube video, easy to remember G protein coupled receptors. Please watch that 6-minute video. You can easily understand all the receptors, second messengers for most of the medications. Question number 48. So which of the following belongs to tyrosine kinase? The correct answer is insulin receptors. Question number 49. The proprietary name of the medication refers to? The correct answer is trade name. So proprietary name, trade name, or brand name. Okay, so all these are, there is a proprietary, there is a company, right? So that's a registered. Whereas a generic name is a official name. We use a generic name like ibuprofen is a generic name, right? So in the Advil and Brufen, all those are trade names, and proprietary name, there is a proprietor. Chemical name, like you have chemically describe what it is. Last question, number 50, first order elimination of the drug. So the correct answer is the elimination rate varies with the dose. For example, you give 1000 milligrams. So in one half-life, you may reduce 50%. That means 500 milligrams is eliminated, first order. Fraction. Or you give 500 milligrams, in one half-life, 250, 50% of the drug is eliminated. So that means the elimination rate varies with the how much drug you administer. That is the first order elimination. Whereas elimination rate constant, this is a zero order. So that means a constant amount is eliminated, right? So good example is alcohol. When you take a lot of alcohol, you have hangover effect the next day because it is eliminate fixed amount of alcohol every half-life. Okay. Half-life varies with the dose, that mainly with the zero order. Volume of distribution, so that is not related to the dose. That's inherent property of the chemical physical properties of the drug. Thank you guys. I hope you guys learned something from these 50 multiple choice questions from the pharmacokinetics and pharmacodynamics. I covered some of important stuff. It is not possible to cover everything. There are some resources from the Burner Steven Pharmacology, Kadjeng and Lippincott and Goodman-Gilman. There are some copies and images we taken from the textbook. Please thank you. Please subscribe, and also we have a channel how to remember form and concise medicine. See you in the next video. Take care.